Live look this morning at a place where it's all about fitness usually. Waiting for that sun to come up there on Venice Beach in California. Nice when the sun shines and people can get outside and stay active and healthy. Hopefully people are going to do that here today. Recent studies indicate that 2/3 of adults in the U.S. are considered overweight or obese. While the gym is one option, some have no choice but to undergo a life-saving medical procedure, bariatric surgery. The Morning Medical Update starts right now. Good morning, everyone. We are so glad you are with us. It is Monday, April 4th. Thank you so much for joining us here on Facebook, on YouTube, and on Twitter. For one family, bariatric surgery was nothing short of life-saving. Antonio and Melissa Rivera and their daughter, Adriana, they watched 4 loved ones die within a span of 3 years. And it was simply a wake-up call. We're going to talk with them about their family weight loss journey and talk with the doctor who helped get them there, Dr. Jennifer McAllister. She'll explain the process and what you need to know if you are considering this. In medical headlines this morning, while it may help control type 2 diabetes, a new study finds metformin, that pill right there, may cause birth defects. The study published in the journal Annals of Internal Medicine finds that men who used metformin 3 months before conceiving a child had a 40% higher risk of birth defects in their offspring. And joining us this morning to talk about that is Dr. Mark Parrish. He is Director of Maternal Fetal Medicine here at the health system. Dr. Parrish, quite a headline if you're just reading that, but you said that this study actually stood out among you and your colleagues for other reasons too. Explain that.
Definitely an interesting headline. We've started to receive messages from mothers that were taking metformin because of this publication that was released last week. It's important to really note the details of that study. We're involving the fathers of the child that were taking metformin within 3 months of the time of conception. And in those specific subset of babies that were being born in that situation where their dads had been taking metformin at the time of conception, there was an observed increased risk for specific congenital anomalies of male fetuses only, male babies, no effect on female babies. What they were observing with the boys were an increased risk for a phenomenon where the testes did not descend like they should prior to delivery. And then the other scenario was where they would have urethral anomalies. But, the one important fact here that we've been emphasizing with our mothers that are taking this medication is the fact that they're taking it for control of their gestational diabetes or their type 2 diabetes. This drug has been studied in pregnancy for 30 plus years, and we've observed no increased risk for congenital anomalies. And contrary to the potential risk, if any, to metformin use in pregnancy, we know for a fact there are tremendous risks for things such as pregnancy loss or congenital anomalies in those mothers that have poorly controlled blood sugars in the first trimester. So we're trying to give our moms absolute reassurance that it is definitely safe for them to continue taking this medication during pregnancy.
So moms, stay on it. But if you're a man and you're thinking of conceiving, get off it or come up with an alternative. And what alternatives would those be?
I would definitely want to defer to the primary care physician or subspecialist that was taking care of the man. But alternatives, we know there are multiple other oral medications that will lower blood sugars. They'll also, insulin is one thing that has thus far been found to be a very safe medication, although people don't like having to inject themselves with any type of medication. It's certainly the gold standard. But so there are many other alternatives. I would advise 2 things. One, for couples that are considering conception here in the near future, either set up a time to meet with your OBGYN for a preconceptual consultation, or I would encourage the gentlemen who are taking this that are planning on bearing children in the near future, that they meet with the doctor that had originally prescribed that medication and have a discussion about the study that was recently released.
Dr. Mark Parrish, really interesting study. Thank you so much for sharing your info this morning. Have a great day.
All right, thank you.
Thanks so much. And please get your questions in to us here on YouTube, on Facebook, and the Medical News Network. You can find links to those right there on your screen. Let's get over to Dr. Dana Hawkinson, Medical Director of Infection Prevention and Control. Good morning to you.
Hi.
Hi.
Happy Monday.
Yes,
Big
right.
night tonight. The hospital, again, we've kind of been sitting in that low to mid-teens for active infections. Right now, 13 active infections, 2 in the ICU, none on the ventilator, still 34 in that additional recovery period, 47. But again, I think the important thing there is 13 active infections. That's really kind of what we're looking at as far as when we get into surges with those things like hospital capacity and workforce and things of that nature. But overall, what we have continued to see is that even though BA2 is the predominant variant circulating across the United States, for the most part of the United States, we haven't seen a large uptick in cases. I think in the Northeast, they are starting to have a little bit of uptick in cases, but we really just need to wait and see how everything plays out now with people being updated on their vaccinations and boosters with a history of infection or those that have been infected and reinfected. Just overall individual immunity as well as population immunity moving forward. But the good thing is right now in our community still cases are not really trending up, so that's good.
Well, that's good news. Did you watch a little basketball this weekend?
Yeah, absolutely.
You coming down from the high? You ready for tonight?
Yeah, it's good. I'm optimistic, and I think Jayhawk Nation is happy to be here, and it's been a good year. When you look back on everything, that loss to Kentucky really certainly hurt, but we've moved on from there, and hopefully a great outcome tonight.
Yeah, making for a good Monday today.
Yeah.
All right, let's check and see if we have any community questions on the line today, or reporter questions. All right, I think we're good there. We're going to get to our community here in just a few moments. Obesity-related conditions like heart disease, stroke, type 2 diabetes, and certain types of cancers are among the leading causes of preventable premature death. The good news is, though, for some, there is life-changing surgery that can not only reduce weight, but improve overall health. Many have seen or heard of the show, My 600-Pound Life, which follows patients weighing more than 600 pounds through their bariatric surgery journey. While the show and shows like this can be eye-opening to viewers about the struggles that these individuals are experiencing, it is often dramatized, as you can imagine, compared to what it is really like when it comes to what these folks are going through and when those cameras are not rolling. And one family is here to share what you don't normally see and how bariatric surgery is impacting their lives now. And we're going to talk about what it took to get to this point. Antonio and Melissa Rivera are here with me in studio, and also joining us is Adriana. She's joining us in Studio B. That is their daughter. So we're going to talk to all three family members today, along with Dr. Jennifer McAllister. She is a bariatric surgeon here at the health system. She's joining us virtually. Good morning, doctor. How are you?
Good morning. Great. Thank you.
Good to see you. We'll get with you in just one moment, but let's start with the Rivera family. So take us back in time a little bit, and let's talk about your struggle with weight when it comes to just lifestyle choices and health issues. Melissa?
I would say myself, I had struggled with my weight since I was about 20, I guess. I had polycystic ovarian disease and gained about 80 pounds in 6 months.
Mm-hmm.
And so it wasn't something that I was used to. It happened suddenly. It happened just in such a quick manner that I didn't really have time to process what was happening.
So Antonio, you saw your parents and a brother die in the span of 3 years. Is this correct?
Actually, to be correct, it was Melissa's parents. Both her parents had passed, and her brother, and it was my father, and all health-related issues.
What was that like
It
for
was
you to see?
It was a struggle to watch what was happening at that moment, especially for my wife Melissa, who was dealing with a lot of emotions at the time. To see, that poor health has taken them away from us. So it was difficult.
So Melissa, talk to me a little bit about that. Just growing up in a family where this was something that was a struggle. What was that like for you?
So weight in my family wasn't necessarily an issue, but it was more diabetes and things like that. And it wasn't necessarily weight related in any way. It was just type 2 diabetes that, came on later on. But myself, being predisposed with having PCOS, I kind of knew where I was going with that. And when I made my decision to have surgery, I was pre-diabetic, so it was a very easy decision after seeing what everybody was going through to actually make that decision.
So, Antonio, what about you? What was your family life growing up and some of those issues?
Hispanic family. We enjoyed eating. We enjoyed getting together, and that took on a whole life of itself where food was a major part of our gatherings.
Yeah, well, that's a good point, though.
Yeah, and the thing is that I pretty much had been a large guy since I was out of high school even, and I was an active person, however, my habits weren't good, and therefore it just kind of evolved from there
So a
too.
lot of those habits start when you're younger, but you make a
Yeah.
good point. We're all Midwesterners. We like to, like we were talking about, we like to get together. We eat for the basketball games and all sorts of family gatherings, and you start to associate food with feeling good, right?
Absolutely, and I considered myself a foodie because I really enjoyed going out and trying different things. However, it just became too much.
Yeah, a foodie. You got to be careful with that word, right? I want to bring in your daughter and talk to Adriana a little bit about your experience growing up, and we're going to talk about your decision to get weight loss surgery. But take us back a little bit.
I would say about the same things, family history. I would say that I've been pretty overweight since I was younger. I mean, growing up, around 12 years old. And then high school, I remember being in volleyball, and I played soccer up until high school. But until then, I think that time of thinking about college and future was very stressful for me. Once again, the family history did not help, and obviously the bad food habits, but all of it just kind of started leading up. But yeah.
So you experience these heartbreaking deaths in your family. That's traumatic, and then you're trying to decide whether you're going to get this weight loss surgery. What finally brought you to that decision? And what did one of you decide first, or did you decide as a couple?
It was actually me. It's funny because I think about a light bulb moment, and the light bulb moment for me was a group of coworkers were going to go to lunch, and they said, "Hey, we're going to walk a couple blocks down. Do you want to come?" And I had to decline because I knew I couldn't make it that far. And it was literally that moment that I decided that's it. I'm done. I'm absolutely done. I've got to figure something out.
What was your light bulb moment?
I knew I needed to have it done. I had a wonderful coach partner here that showed me the way, and I knew that she was determined. She was amazing. She kind of had that mentality of a physician where she was just researching everything and collecting everything together. Actually, she impressed me the most when she started writing down her pros and cons and sharing with me along the way about things that I needed to pay attention to that I wasn't. I just knew I needed it done. But she helped me along the way with this. She encouraged me.
So how'd you take that first step? Did you make a phone call? Did you talk with your primary care provider? What was the steps?
Well, being here, working in the hospital for almost 26 years, I had worked with Department of Surgery and worked with one of the schedulers actually for Dr. McAllister and her team. And so I just remember reaching out to her, and I'm like, what can you do to get me on the schedule? And it's a long process. It's a very long process. It's 6 months of very intense goals that you have to meet. Setting goals for myself. I did sort of a reward program, like if I lose 20 or 30 more pounds, then I'll buy these shoes or get my nails done. So for me, I really had to have something to motivate me and to really keep me moving.
Dr. McAllister, let's bring you in. Talk to us about, good morning, by the way, glad you're with us. Tell us just about what people need to be keeping in mind if they think that bariatric surgery is right for them, or any type of medical procedure to help with their weight loss.
Well, yes, I think Melissa has just really summed it up wonderfully. That, you can reach out to your primary care physician. Certainly they can help with referral to not only bariatric surgery, but as well as potentially medical weight loss. And the key thing to remember is that, surgery is not a magic cure. It is a tool to help patients achieve weight loss. And boy, Melissa just put it beautifully, as did Antonio, what it takes to be successful. To really be motivated, to research the options, and then figuring out ways that ring true for each individual. of how do you continue to motivate yourself along the process.
So they were talking about kind of those light bulb moments that happen physically that said, okay, I can't make it down the street with my colleagues. I can't get up. I can't move. I can't vacation. I can't ride a ride, with my kids, whatever that moment is. But let's talk about the mental aspect. How do you know that somebody is emotionally ready to go through this?
Right, it's an excellent question because as we all know, food is much more than just nutrition. And so part of evaluation for any potential bariatric surgery involves really a multidisciplinary team. So not only meeting with the surgeon, but also all patients meet with our dietitian and have ongoing counseling. That way they know ahead of time, what will eating be like after surgery? What are the keys to be able to make successful food options after surgery? What activity is required? And then we also work very closely hand in hand with our psychology group. Again, making sure that every patient is at the healthiest point they can be to have this operation and make healthy lifestyle choices afterwards. And then also all those resources are still there to help guide our patients afterwards because we know those issues don't go away. The social stressors, a lot of our life revolves around food and eating and learning how to approach that system now with a different digestive tract. So there are a lot of changes that come along with surgery, and many of those changes are wonderful, and some of them require a little extra strength and work to help navigate, but all worth it in the end.
Yeah, challenging. What was the most challenging part for you, Melissa?
I think the maintenance part at this point, so I'm around 3 years or so out. And of course you get down to, after surgery, you get down really low in a weight and then your body sort of bounces back a little. So for me, that was the biggest challenge of my body trying to even out where it needs to be. So that's the biggest challenge so far.
And so we're going to kind of be showing some before and after photos of you both. But what was the biggest challenge for you, Antonio?
Paying attention to my body. It's you see yourself as that person that you were when you were heavy, and then you're going through the transition and paying attention to your body. It's telling you something, and it's just like before, but we weren't paying attention. And I would always look to my wife, and she would kind of like, hey, let's talk to Dr. McAllister about some of these things you are going through, and you figure it out.
So did one of you go first? And so did you have your surgery first and then you followed?
2 years.
You're 2 years out. And someone who's just 1 year out is your daughter.
Yes.
Adriana, tell us about what went into your decision to go forward with this surgery.
Obviously, my parents were a very big inspiration. Seeing what they overcame, seeing their new lease on life at their age, it was very inspiring. When I saw that, I knew I didn't want to let that chance go by. I wanted to take the opportunity and just seize my life. Like I want to live my life to the fullest, and I wanted to do that now.
I love that. Very inspiring. What has been the most challenging part and what's been the best part?
The best part has probably just been the new experiences and just looking forward. I am very excited for the rest of my life. I would say the most challenging part has been the relationship with food. I feel like it's been a struggle for me, just the months after surgery, relearning how your body works and what you're able to tolerate, and that whole relationship with food, I think, has been the biggest struggle. Although you kind of get past that, and I'm almost a year out, so things are kind of bouncing back to normal. So.
Well, we talk about the relationship with food. Help us through that a little bit, because you mentioned how food is such a joy and you enjoy it, and then you go from you kind of fight with it now.
You still get to enjoy it. You just get to a point in your life where you're regulated, and don't forget water. Water has been a huge part of our life, and I consume so much water that it helps the process here, the system, and you get to enjoy the foods that you've always enjoyed.
Properly. Yes.
Yeah, you just take so much. Listen to your body, and it tells you. If you want to gorge yourself, you're going to be in pain. Your body's telling you something. Whereas before, 2 servings was nothing for me. I almost reached 450 pounds at one time. So it was, I didn't understand what I was doing to my body. And Yeah.
So you don't feel like you gave up as much, it's just how much you were eating, or
That's
did you
right.
have to give up anything?
You know what? Sugar. It's you learn what the sugar does to your body. You learn how that process in your body. I mean, it's dangerous.
Are you cooking differently at home?
Oh, absolutely. Absolutely. And especially since it helped me because when I could have transitioned to having normal foods, then Antonio started his process. So then that put me back on track again. And then when Adriana came and decided to do the surgery, it put us both back on track again. So we're definitely, always focusing on our vegetables and our protein. And we can eat out. We can eat some pizza but you're always mindful at this point. You have to listen to your body. You have to say, okay, I'm done, I'm full. And you learn to pay attention to yourself. You learn to put yourself first.
Yeah, not to mention you get the energy back. You get energy to want to do more. Walking is one of my favorite things in the world right now. I just love walking, biking, and you realize that now you can get on a bike and not worry so much about, breaking the bike.
Well, that was my next question is what weren't you doing before that you as a family are looking forward to doing now?
Yeah.
Is there anything
A lot.
that's on the list?
There's so many things that are restrictive. I mean, especially, we have two other children who aren't overweight, and the three of us, I felt like it was so restrictive because we couldn't all fit in the same car if we were in a smaller car. We didn't want to travel. We didn't want to go to football games because we couldn't fit in the seats. We didn't want to go to Worlds of Fun because we didn't fit on the rides. The energy boost is unbelievable. So, of course, shrinking and being able to actually physically fit places, but the energy is unbelievable. And honestly, had I known that I was going to feel this good at this age of my life, I would have 100% done it 20 years sooner.
Yeah.
I bet.
Absolutely.
Adriana, same question to you. Anything specific that you're looking forward to doing? You got a lot to look forward to. You're pretty young. So, but what are you loving being able to do that you really had to think about before?
I would say one thing that was always on my mind is, I'm pretty young. I very much look forward to having a family at one day. So I think that was a very big factor of, wanting to be there in the future for my kids. I want to enjoy life with them. I've always thought very far in the future. So I would say that was probably a very inspiring point.
Dr. McAllister, it must be lovely to see success stories, but how do people maintain that success? Not just year to year, but day to day, over a lifetime. It's a lot of work. What makes for a success story?
Well, you're absolutely right. It is a lot of work. And I think the important thing for patients to realize and for all of us to realize is that obesity is a chronic and difficult to treat disease. And so that means that patients just can't forget about it. I would love it if I could tell all patients you're never going to have to worry about your weight again, but that's just not true. They're always going to have to pay attention and keep track. And so keys for long-term success, making sure that patients continue to weigh themselves. And so usually we say long-term, at least once a week. And again, we're not focusing on weight as our outcome here. Really, it's all the other health improvements that come along with these operations. But the scale is just the easiest thing for patients at home to really be able to keep track of. And really doing that just to be mindful of where their weight is. And that way, if there is a little weight gain, we catch it at that 5-pound weight gain and not that 20, 30, or 40-pound weight gain. And then I think another thing is really the keys are both diligence, but then also grace. And so if we do have those days where we don't eat well or we have that little increase in the scale, not going to our knee-jerk reaction, which would be beating ourselves up or being shameful that had happened, but really more being curious and using that as just another learning opportunity in life and in this journey. And when those things happen, really sitting back and trying to figure out, okay, what happened during this day? What led me to eat that cookie or the second one when really maybe I just would have had a bite or two before? And trying to find what are the root causes of our behaviors and really taking the time to figure ourselves out and realizing, okay, these are the things I do on a daily basis that make me feel my best. And how can I create that routine and system for myself? So it's a long-term process. It takes a lot of work and a lot of diligence on the patient's part.
Let's get to some community questions. And Judy has one. Dr. McAllister, for you, does insurance cover this procedure?
Yes, so the good news is the majority of insurances do cover bariatric surgery. Unfortunately, not all do. So every patient would have to call their insurance company to inquire. In general, though, the qualifications for bariatric surgery is anyone who has a BMI above 40, and BMI stands for body mass index. That's something you can find a BMI calculator on the internet and put in your height and your weight, and it'll give you that number. So a BMI above 40 or a BMI above 35 with comorbidities that are associated with obesity, such as diabetes, fatty liver disease, obstructive sleep apnea, multiple more. Those are just to name a few. Those are the general criteria for insurance approval.
And Dr. McAllister, Isaac wants to know, and not to put you on the spot, I don't know if you have these stats, but do we know the obesity rates in Kansas or Missouri or where they measure up nationally? Of course, he made a comment about all the good barbecue that's around here. He can't imagine, he thinks we might be somewhere near the top, but is that true?
You're right. I don't have those details here at my fingertips, but certainly in both Kansas and Missouri, we are, I believe, within the top 10 of both overweight and obesity rates. And as you mentioned to start the show, over 2/3 of Americans are now overweight and obese, and that number is rising. And I will put out the plug for Kansas City that there are still healthy options that you can have from a barbecue joint, and that can be a part of your bariatric diet. So we don't have to rule those out.
Good. Okay, good tip for sure. Yes, don't take our barbecue away from us. Question, you also mentioned at the top of the show, we talked about the television show, reality show like 600 Pound Life. We've seen The Biggest Loser on all sorts of like transformation shows. Dr. McAllister, are those good or bad? Does that help inspire people that from your standpoint? Do you think those are good for society? I do watch those shows every now and then. I always sit back and think that I stand in awe of people who could kind of go down that road and take on that challenge, and it's really inspiring. But do you think that's good or bad?
Well, I don't know if it's either. I think it's great that as a society, we bring awareness to this. But then also we need to bring awareness that not only is bariatric surgeon the only potential treatment arm, we have a growing number of medications, lifestyle change programs, so multiple things. And really, I think the more important thing is that if it can bring awareness to one patient, let alone many, that there are treatment options, and the fact that obesity is a disease, then I think, and yes, from that standpoint, it is a good thing to watch. I'll admit I don't watch it often. I think I get enough daily joy in seeing families like the Riveras that I get my fix from that standpoint.
Right. And I'm always just in awe that these folks have to lose so much weight and have so many other things they have to do before they even get to the surgery. We were talking about that, Melissa, that this is such a showing that they're so committed to a lifestyle change.
Oh, absolutely. You have to, for us, it was 6 months of doctor set goals. We had to hit our milestones, and the next time you had to go every single month and show that you were consistently losing, and it gives you that time to really focus on what you're going to be doing long term.
Lynn has a question. She says, you hear stories of people gaining all of the weight back. Do people continue to have the same food cravings post-surgery? I'll ask both of you first what that has been like post-surgery.
Yeah, actually you do. It's not as intense as it was before. I can truly vouch for that. I remember what it was like to just be thinking about what I wanted, and then it went on to let's get there and go get it. And it wasn't just that; it was just how much do you get, because you were just so much thinking about the food. You still do think about a good burger or a good barbecue, whatnot. But again, your body is realigned. The tool that you had, the surgery that you had, put us here to make better decisions. And again, listening to your body, you can overdo it sometimes. And what you need to do is just say, hey, listen, I'm full. I'm feeling good. And you have no other choice but to put that food down.
Adriana, any cravings or struggles, and how do you fight through those?
I would say the same thing. I feel like there's times that you have those cravings for whatever food, and it may be like the burger, fast food, stuff like that. Um, but sometimes it doesn't always agree with your stomach, and there's a lot of those foods that just are really hard to on your body. And like my dad said, you just got to listen to your body, because even though you're craving some of those things, like it's not worth the physical uncomfortable and the pain sometimes. So
All right, I'm going to ask Dr. Parrish. I have a quick question for you. Jen has a question about pregnancy. If somebody is pregnant, do they need another shot if they've already had a booster?
We're on to COVID, I assume.
We've got to, I got to bring you a COVID question.
Okay,
in
yeah,
there.
yeah. Okay, just making sure that's what we're
There is
talking
no
about.
segue.
That's
It's
a good
just
assumption. Yeah. No, I like. No, at this point, if they've had their booster, we're not saying that it is necessary for them to get another shot at this time. Certainly, those recommendations may change as they have been, but at this point, we're not recommending an additional injection beyond the booster.
All right. I know, Dr. Hawkins, and I got several text messages over the weekend of my friends who are 50 and wanting to know if they're supposed to go ahead and just answer that question now. What is the recommendation?
Yeah, it's not an easy answer. What the recommendation is that for adults, again, non-immunocompromised, so immunocompetent adults 50 and over are able to get an additional booster, so a second booster, to be up to date with their vaccination, if it's 4 months from when they had their last. That is I guess that was okayed by the FDA. We know the CDC is meeting. We know there will not be an ACIP meeting for those recommendations. We also know there are experts who don't fully agree with that at all. We know that your protection, even from that third dose or that first booster, continues to provide good protection against hospitalization anywhere, depending on maybe comorbidities, anywhere from the low to mid 70s to 80% reduction in hospitalization. But the question was, what was the recommendation? That's the recommendation, but we also understand that right now experts are split. Certainly if you are in that older age group, especially 60 or 65 and older, it's probably a good idea to go get that second booster here if it's been more than 4 months, especially if you've kind of gotten to that 5 or 6 month time period. But we also know that right now there is still circulation of the virus, but it is much lower. We know BA2 is circulating right now. And so those are really things you should speak about with your medical team and your physician if you should get it, because it is not a clear black and white answer. And so there are details in there as well.
Dr. Parrish, Adriana talked about one of her goals is to be able to start a family and to stay healthy when doing so. How much does weight affect a woman's ability to conceive and carry a pregnancy?
A lot of the issues with weight is the higher that your weight is, then you have this increased risk for insulin resistance. And I think we were talking about this disease known as polycystic ovarian syndrome. Both of those scenarios result in it being difficult for a mom to have normal ovulatory cycles. And so just becoming pregnant can be very difficult for these patients that are overweight. Once they do become pregnant, with that insulin resistance being present, there are increased risks for miscarriages to occur. There are also increased risks for there to be congenital anomalies because of the insulin resistance having a direct effect on maternal blood sugar levels in the first trimester. During that first trimester, it's very important in our world anyway to make sure that moms are maintaining a normal blood sugar level throughout the entirety of the pregnancy, but that first trimester is critical. And so there's certainly a lot of important aspects of weight and its potential effect on adverse pregnancy outcomes, and a very important conversation to have with your primary care physician and or your OBGYN.
Couple more quick questions, and we'll get to final thoughts. Dr. McAllister, somebody asking, Joe wants to know if you're familiar with sewing machine weight loss surgery. Are you
Yeah, so I
familiar with that
anticipate
term?
what they're Yeah, I think probably what they're referring to is that not only are there bariatric operations, which today are mainly done laparoscopically, small incisions on the belly cavity, or robotically as well, but there are endoscopic, meaning through a scope, through a procedure, through the mouth, in which the stomach is sewn or plicated in layers. That's what is referred to as an endoscopic sleeve gastroplasty. And so that is another treatment arm of potential weight loss.
Pros and cons?
The pros would be that the success rates are still there, not quite the same yield as what the bariatric operations are. They can be an option for patients who maybe have other comorbidities or illnesses that would make them not be a candidate for a bariatric operation. And then con would be long-term durability. Certainly in the world of bariatric surgery, we've had procedures before that were plications or decreasing the lumen, and long-term maybe have not been durable. So time will tell on those, but also a good option for maybe those who don't have the surgical options.
Steve wants to know, how about using phentermine? Am I saying that correctly? First, before having the surgery.
Yes, so phentermine is one of the approved weight loss medications. And I think the key here is the approach to weight loss, in that it's not a decision of medical weight loss versus surgical weight loss. You know, as I mentioned, obesity is a chronic and difficult to treat disease, which means it's going to require multiple treatment arms. And so some patients, yes, their treatment regimen or treatment pathway may be that we do those medical weight loss options in order to get their weight down to a healthier weight for surgery. Also, after surgery, patients who may have some element of weight regain, you know, we very commonly will institute some of the pharmacologic or medication regimens to help them maintain their weight. So I think the key is that this is really a treatment pathway that requires multiple different avenues.
Last question for you, doctor. Can someone be overweight and still be healthy?
Yes, and so with the overweight standpoint, you know, some may not have those medical illnesses that go along with that. You know, the key would be following those patients long term, and does that overweight status, and then if weight progresses into the obese category, does that increase their risk of comorbidities along their lifespan? And what we know is yes, it does.
All right, we're going to get some final thoughts from our guest today. Great conversation. Really appreciate you sharing your story with us today. Melissa, I'm going to let you just share your final thoughts for our audience.
I guess my final thoughts on this would be, if you are doing your research and you feel like this is something for you, and you feel like you're doing those checklists and your pros and cons and your pros for surgery are adding up, and you feel like you're missing out on things in life, take the step and call and talk to your physician's office. You have nothing to lose by talking about it, and just personal experience. I mean, taking my husband for a helicopter ride for the first time, something he always wanted to do, but there's that weight limit that we couldn't do. Adriana wanted to ride a horse, and that was something she always wanted to do, and so taking my family to do that. So for me, there hasn't been any negatives, and I say just take the first step.
Antonio.
It is hard work. It's just like anything else. You've dieted before. You've put in the effort to watch what your intake is and exercise. It's no different. You build up a support system. I had it at work when I went through the surgery. Of course, I had it at home. My physician was wonderful. Thank you. And it's something you can push through. You just have to prepare yourself. And again, my wife, my coach, was great at that. She helped me align myself, showed me where I can find information on Facebook with weight loss groups, and paying attention to some of the questions and some of the stories that they told, and knew I would be going down that road myself. I learned a lot, and just know that you can get through it, just like dieting. And the struggle was there for a little bit, but then you knew once you get past it and you have the surgery, life is different, and it's been well worth it. I feel better.
Adriana?
I feel like we've done a good job at summing it up, but I feel like if you need that help, I feel like it's an excellent resource. I feel like there's sometimes a negative connotation, but I agree with my mom. If you think and you're considering it, it's always worth looking into giving a call and just getting a consult. It has obviously been life-changing for all three of us, and I wouldn't change the world for it.
Thank you to all three of you. Much success. Thank you. Dr. McAllister, final thoughts.
Oh, I would just like to thank the Rivera family. You know, everyone's personal weight loss journey is just that. It's very personal. And these stories, they're not often easy to share. So I applaud them for their willingness to do that. They are amazing examples of what you can achieve with this successful tool. And I'm thrilled that they're willing to be advocates for other patients out there as well.
Dr. Mark Parrish, I'm going to let you have a final thought. How, and you can say something about the Jayhawks if you want.
Oh, I was going to, but I'll start off by also just reiterating what Dr. McAllister said. Thank you to the Rivera family for, bringing this important topic to light. In regard to just pregnancy-related issues that we've discussed, please feel free to call any OBGYN or maternal fetal medicine specialist here at the University of Kansas for questions or concerns that you may have about any pre-existing medical condition that you have. For those moms that are taking metformin right now, please feel free to call us, but I promise you we're going to give you nothing but reassurance. For those moms that have had gastric bypass surgery in the past, including Adriana, if you're interested in a preconceptual consult and just what the risks are in pregnancy with having that history, we're more than happy to give you insight. But I can tell you the punchline is the majority of the time we're seeing a very successful, healthy pregnancy outcome for both mom and baby. And with that, I also just throw out Rock Chalk Jayhawk.
Of course, I'm going to let you get that in there. Thank you so much for being with us. And I'm sure, Dr. Hawkinson, you probably feel the same way.
Yeah. I also like to say, the last week or so, and even before that, we continue to have shows and information about prevention. And prevention really is the best medicine. And that prevention to help you have a good quality of life, to help your loved ones have a good quality of life. We heard this great story today, and it continues to be important. It does take a little work, but overall, it will help your quality of life. Prevention, meet with your medical teams, do your cancer screenings, get your vaccinations, of course, importantly. Work on those lifestyle changes really to make your quality of life better, to have longer and more meaningful time with your friends and your loved ones. And overall, it will help you to have a great quality of life. And again, with anything, and Dr. Stites and I have said this, it is better that you don't come to the hospital, and we prefer you're not here. And by doing these little things, whether it's just getting out to move and walk and then run, or it's weight loss surgery, and just adding to that quality of life is overall going to help you. So.
All right, good.
Rock Chalk, yes.
Yes, of course. We'll be watching. Yes, okay. I want to read a really nice email that we got over the weekend from one of our viewers, Denise. She used to live in Shawnee, Kansas, and now she calls France her home. She says, I enjoy watching the daily Facebook replays from France. I want to thank all the medical teams and our guests, like both of you today, all three of you today, who have appeared and driven the show for over 2 years. The Morning Medical Update has informed and reassured me during this pandemic. Always there to guide us and help us heal in the best fitting way for us as an individual. Thank you. And thank you so much, Denise, for watching us all the way from France. Well, this Thursday is the Royals home opener. We know a lot of you have some good memories of that, and we want you to share them with us right here on the show. You can just hover over that QR code right there, and you can send us some pictures and share your stories with us. So we'd like to be able to maybe share them right here. Yeah? Oh, okay. What are you pointing at? Oh, my J. Oh, yeah. Oh, yeah. Okay. I'm going to bring that up here in just a second. I'll bring that up here in a second. Okay. Anyway, so go there on, there's that information there on your screen. So send us your fun Royals memories. Dr. Hawkinson just got me all wound up. Now he's back onto the Jayhawks.
Improvisation is
okay. He gave me his little
suit.
Jayhawk bobblehead here, so that's all my good luck there for that. So Thank you for setting that. Okay. Again, you can also email your memories to us on the Medical News Network using the address right there on your screen. We're going to read those there on home opener day, which is Thursday. So go Royals. Okay. Now, a live look at Bourbon Street in New Orleans, where lots of Jayhawks fans will be celebrating here in just about 11 hours as the Jayhawks will face North Carolina for the NCAA Men's National Basketball Championship. When KU wins tonight, when they win, Bill Self will get his second national title as head coach and a fourth trophy for the Kansas program. That would place it behind only 5 other schools on the all-time list. So there will be a lot to celebrate tonight and tomorrow. And here's kind of a sign that was posted on Twitter, kind of says it all if you... Let's see. Can we take a look at that? Okay. So Jayhawk players, shining bright. Look at this. Some of those folks celebrating on Mass Street on Saturday night. We don't have that. Okay. We don't have that either. Okay. So anyway, just a lot of excited players there. Rock Chalk, Jayhawk. Yes, a lot of happy fans out there. So tip-off is tonight at 8:20, kind of a late game, but you can hang, stay up late and watch it, and we'll be celebrating tomorrow. Thank you so much for being with us today. You can catch our show anytime on Facebook, YouTube, and Twitter. Before we go and inch our way towards it tonight, we're going to leave you this morning with some words from head coach Bill Self addressing those KU Jayhawks.
Men, you're playing for a national championship. All right? The best is still yet to come. Yep. Like a champ. Go! One more, y'all. National champs. 1, 2, 3. National champs!
Coming up tomorrow on the Morning Medical Update, we talk minority health care, what's being done to reach those underserved when it comes to basic health care needs. Join us at 8 on these social media channels.
Subscribe to our Morning Medical Update and Open Mics with Dr. Stites podcasts. Now, everywhere podcasts are available.